Good day everyone. Today we are going to tackle about parasitic protozoans, Toxoplasma gondii. This comprehensive report is prepared by Casas Emilin B, Ingenti Eileen A, Tubia Jerin M, BSN 3A. Presented to Bagalay Dimiyapi V. Overview of Toxoplasma gondii. Toxoplasma gondii is a prevalent protozoan parasite of medical and veterinary significance. It is the etiologic agent of toxoplasmosis, a neglected disease in which incidence and symptoms differ between patients and regions. In immunocompetent patients, toxoplasmosis manifests as acute and chronic forms. Acute toxoplasmosis presents as mild or asymptomatic disease that evolves under the host immune response into a persistent chronic disease in healthy individuals. Characteristics of Toxoplasma gondii. Toxoplasma gondii exists in three forms. All parasite stages are infectious. Taxozoites, groups of clones, bridozoites, tissue-sized, sporozoites, oocytes. Taxozoites and bridozoites in tissue cysts develop inside the host, while sporozoites develop within cat-shaped oocytes.
Let's proceed to the classification of Toxoplasma gondii. In its clade is AR, infrakingdom Alveolata, phylum Apicomplexa, class Conoidocida. Its order Eucosideuridae, family Sarcosistidae, subfamily Toxoplasmatidae, its genus Toxoplasma, and species T. gondii. Let us proceed to host or host range. Toxoplasma gondii is a protozoan parasite with a complex life cycle and a cosmopolitan host range. The asexual part of its life cycle can be perpetually sustained in a variety of intermediate hosts through a combination of carnivory and vertical transmission. However, T. gondii produces gametes only in felids after the predation of infected intermediate hosts. The parasite changes the behavior of its intermediate host by reducing their innate fear to cat odors and thereby plausibly increasing the probability that the definitive host will devour the infected host. And now let us proceed to the pathogenesis or modes of infection and transmission of Toxoplasma gondii. Toxoplasma gondii infects not only macrophages but also many other cells in types of incorporation process actively controlled by protozoan. Toxoplasma gondii does not produce a toxin. Necrosis is caused by intracellular multiplication of tachizoites. Most cases of toxoplasmosis in humans are probably acquired by the ingestion of either tissue cyst in infected meat or oocyst in food contaminated with cat.
Let's proceed to the symptoms, prevention, control, and treatment of the Toxoplasma gondii. Diagnosis of toxoplasmosis can be aided by serologic or histocytologic examination. Clinical signs of toxoplasmosis are nonspecific and cannot be depended on for a definite diagnosis. Toxoplasmosis clinically mimics several other infectious diseases. Feeding of oocyst fecal samples, zoonotic risk, serology on ill animals. To prevent T. gondii infection, several precautions should be taken. Meat should be cooked to 66 degrees Celsius throughout before eating. Hands should be washed with soap and water after handling meat. Raw meat should never be fed to cats. Only dry or canned food or cooked meat should be fed. Cats should be kept indoors and litter boxes changed daily. Treatment for cat shedding, not titers. Clindamycin shortens shedding period. See, useful shedding is the infectious form. Sulfonamides and pyrimethamine daraprim are two drugs widely used to treat toxoplasmosis in humans. CAPC recommends cats who test positive for antibodies to Toxoplasma gondii should be considered unlikely to shed infectious cysts. Most infected cats will also remain asymptomatic. Eliminate cat feces on a daily basis. Toxoplasma gondii cysts require 1 to 5 days after being passed in the feces to become infectious.